Hi everybody, it's Mike Delaney. I just wanted to have a little chat really about COVID and depression, anxiety. I'm seeing more and more people. I'm getting lots and lots of phone calls. So I've got a strong feeling that there's going to be a tidal wave of mental health issues about to hit us. And I think the bulk's going to be anxiety, depression types of conditions that's been caused by COVID. I think the whole COVID situation caused an underlying fear to spread, and that's what newspapers and the media and government are feeding into, and they're having a killing because everybody's frightened. Lots of people are frightened. And people are now frightened about COVID ending and going back to normal, and how is it going to be and how we're going to get on with people. And so there's anxiety building about reconnecting. And I think the biggest part of the problem really has been the disconnect. I think as human beings, we're so used to being able to bump into each other and hug and shake hands and kiss and whatever, and suddenly for 9 months, we've had none of that. We've had none of that at all, and we don't realise it, but touch is very important to human beings, as important as food in many ways, because it's a soothing kind of safety mechanism that helps us all to feel okay and loved by other people. So suddenly to have that taken away has been really difficult, even although we don't consciously think about it, but it has caused problems for a lot of people. So thinking about that and thinking about moving forward, just a few suggestions really. Number one, rest, very important. Get enough sleep. Don't be sitting up all night worrying about everything. Actually get yourself into a routine. We talk about sleep hygiene, so try not to watch television in bed. Try to make your bedroom about going to bed and going to sleep. Keep the lighting low. Don't use your social media, phones and things too late into the night, because it can keep you awake. So try and get your sleep pattern into a reasonable routine. Secondly, mindfulness. Mindfulness is getting bandied about everywhere at the minute, but mindfulness is a really good way of managing what's happening in your body. So anxiety and fear and depression, you can actually do some really good mindfulness things that help you to manage that better. There's an app out at the minute which I'm using every single day called Aura, and it's got lots of different options. You can tap into it if you're feeling depressed. You can tap into it if you're feeling anxious at night time. You can tap in if you're not sleeping. So it's got lots of different guided meditations and relaxation music and ways of training your body into being more relaxed and less freaked out by everything. Another thing would be avoid the news on television and media, because good news doesn't really sell papers or get viewers. So most of the news that you see is about Brexit or COVID or the amount of deaths that are happening. So it's all kind of feeding into that. If you're already anxious, it feeds into that fear and makes it worse. So if need be, stop watching the news. I don't anymore. Occasionally I nip in online and I look at a Channel 4 News or something like that just to see what's happening. But I tend to avoid the constant barrage of bad news, because it brings you down. It brings you down. Another tip would be to share how you feel. So don't think that because you feel like that, no one else is interested. Share with your family and friends. Have conversations about it. Process it. Don't allow it to be the big elephant in the room and everybody's dancing around you because you're anxious and they don't know what to say. So if you broach it and explain how you're feeling and ask for what you need, people often don't know what to do. So maybe just say to them, I don't need anything, I just want you to be here, or I want you to phone me and check that I'm okay. So ask for your needs to be met. Don't try and expect other people to guess what they are really. An important thing I would say also is avoid isolation. Your head, when you're in that state, tricks you and wants you to be on your own so that you can make it worse. It's the kind of catch-22 situation. You don't want to speak to anybody, but actually by speaking to someone and by reaching out and asking for help, you can start to feel better. So try and avoid isolation. I know a lot of people are on their own, but try and connect with people on social media or on the telephone or whatever, to just have somewhere to put your feelings and to talk to someone. If things get really bad, if you're feeling at the end of the rope, if you're feeling that you can't go on, then your GP is your first port of call. So getting an emergency appointment. If your GP isn't available, no appointments available, if it's the evening, get someone to take you to A&E and go and tell the staff in A&E how you're feeling and ask them for some help. They might not always be able to immediately fix you, but they might be able to put you on a list or refer you to a team, or very often A&Es have got a duty psychiatrist in the building, so you would at least get seen if you were thinking of harming yourself or anything like that. I think the thing for myself, as someone who has been in that position and who's been completely suicidal and didn't want to be here, time, even just a few hours, can change that feeling. So if you're feeling that you need to do something crazy, just go by minute to minute and try and convince yourself otherwise, because it's amazing how your brain can change in a short space of time. And those type of thoughts are disordered. They're not normal thoughts. So when you're thinking like that and you're believing that, yeah, it would answer all my problems, it wouldn't. It just creates a whole other pile of problems for other people as well as yourself, because most people don't actually make it. So it's problematic. So back to positivity. If you've got any kind of anxiety, depression, share it, rest, eat properly, sleep properly, mindfulness, routine, sleep hygiene, do things during the day, even if you're stuck indoors. Make a plan so that you're ticking off things that you want to be doing, and at the end of the day you've ticked all your boxes, you actually feel a little bit better and you go to bed feeling a bit tireder. Try and avoid lying about on the couch sleeping all day, because that affects your ability to sleep at night. So I just thought I'd throw that together and put it out there for anybody who's struggling a bit. I hope if you are, that your mood lifts soon. I hope you get any support that you need. I'm on social media. Message me if you want to offload and have a conversation. I get quite a lot of communication and private messages, so feel free to do that. I've not got a problem with that. Or info@mikedelaney.co.uk, and I can respond to your emails when I've got time to sit and do that. Okay, so hang in there. Things are getting better slowly but surely. It's going to be okay. Take care.